calling the meeting order at this time. May we please stand for invocation and pledge of allegiance. As we come before you on this day, to the creator of all that we know, we thank you for this beautiful day. We thank you for the opportunity to serve the people of the city of Florence, South Carolina. We ask that you be with us and guide us. Lead us with your wisdom and knowledge, that we remove ourselves and place the people of Florence first, that the city of Florence will be a beacon of light to all those who surround us, as well as good neighbors. So we welcome you into this meeting this day to have your way, that the way that we create would be a safe rite of passage for all. It is in your precious name that we do pray. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
In accordance to our agenda, we are now at the place for introduction of resolution. First, we have resolution number 2021-15, a resolution to strongly recommend and encourage all citizens to get one of the FDA approved and authorized vaccination for COVID-19. Do we have a motion?
Second.
We have a motion and a second. At this time, we're going to hear from our city manager, Mr. Randy Osterman.
Thank you, Mayor, members of council. The resolution in front of you, at the request of council, follows the guidance of both South Carolina DHEC and the CDC, with both agencies advising that in order to effectively combat the spread of COVID-19 in our community, in our state, and in our country, a vaccination rate of 70 to 80% of the population is needed. So therefore, the following resolution follows that recommendation by stating the city strongly recommends and encourages all persons eligible to receive one of the FDA approved or authorized vaccines to do so immediately in order to protect you, your family, your neighbors, and your fellow citizens from this extremely dangerous COVID-19 disease.
Thank you. You've heard the resolution from our city manager. Do we have any discussion?
Yes,
Chair recognizes Councilwoman Pat Gibson Moore.
okay. We know that our president of the United States is recommending that employers with more than 100 employees get them vaccinated or tested every week. What are we doing for the city of Florence on that note?
As far as the vaccine mandate goes, we have been instructed by South Carolina OSHA to basically stand by for guidance, although the president made his announcement. The details or the logistics of his order, or of the, I guess, the anticipated order, hasn't been released. And we have received instruction from South Carolina OSHA to wait before starting any action. On a voluntary basis, the city has provided incentives to our employees to receive vaccinations through additional sick bank hours. And we are encouraging our employees to receive vaccines. So we're trying to work the carrot portion of encouragement to have our employees vaccinated.
And what percentage, do you know what percentage of our employees are vaccinated? And how often are they getting tested for COVID if they're not?
They are getting tested.
The ones that are around the public.
Our employees are getting tested as recommended by our on-staff nurse practitioner. And the other part of your question was what percentage? I will tell you, we are, I believe, a tick under 40% is an estimate.
Because I do know that we've had a lot of employees out because of COVID over the past year.
We have and continue to have, yes, ma'am.
An employee came up to introduce himself to me one day that works in public works. And he wanted to shake my hand and I said, "Are you vaccinated?" And he said, "No." I said, "Well, you need to get away from me." He wasn't vaccinated and without a mask. I said, "It's nice meeting you, but we were not shaking hands."
Do we have any other council member? Chair recognizes Councilman Jabala.
So the CDC has been recommending, we've been having information presented to us by all sorts of different local, regional, and national medical people that the way out of the pandemic is through vaccinations. That's our way out. And it resonates whether it's inside the city, inside the state, or inside this country. And the number of Florence County, as is in the resolution, it identifies that only 50% of eligible Florence County have been vaccinated. And we need to, this resolution to encourage that is a part of what we need to do to continue to encourage our citizens to do it for yourself, do it for your friends, do it for your family, do it for your neighbors, do it for your coworkers. You know, there was a time when patriotic action was doing things for a greater good. And I still believe in that. And I believe in the power of doing something for the greater good. And this is the greater good. And each and every one of us has an opportunity, literally in there with a shot, to take one for the team. And I'm asking and begging and pleading with all of our citizens who are age 12 and over, please take one for the team.
Take two for the team.
Take two for the team, unless you're with the Johnson & Johnson. I guess there's only one. But to take two for the team, take it for the team. Do this. Please do this. It is literally a life and death situation, and we know that. So I am proud of our council. I'm proud of the way that this is coming before us, and we're going to have an opportunity to make our statement to the public, to the community, that says we know the way out. We know vaccinations are the way out. We know this is critical. And while 50% is better than less, we know that to hit, as is in here, to hit the numbers that we need to hit, it's the 70 to 80%. And that means those of you who are out there who have not gotten vaccinated, it's up to you. And it's up to, and I encourage all of our listeners, all the people to, if you have a friend, a family, or coworker who is not vaccinated, have a talk with them. You know, don't berate them, but have a talk with them and encourage them. Because sometimes that one-on-one conversation, which we know now, those one-on-one conversations mean a lot. They make a difference. And so have that heartfelt conversation with others, and let's get them to take two for the team. I like that. Thank you.
Chair recognizes Councilwoman Barnes.
I thank you, Madam Mayor. When we look at vaccinations, I'm not understanding why vaccinations that have been a part of our lives since we entered into this world, vaccinations have been a part of us. For some reason now, we are this false narrative of us against them, and if you do it, you're going against us, or we don't trust the medical professionals. We've got to get back to trusting those who are trained to give us what's best for us. That's how we've survived as a country. Every generation had something that they had to be vaccinated for. And this political environment has taken this and made this about politics. It is not about politics. It is about saving lives. It is about following those who have always led us out of pandemics. And there are too many of my family members, my friends, who are saying, well, my daughter said she saw something on Facebook, so I don't think I should get it. What did your doctor tell you? Your doctor told you to be vaccinated. So you need to follow what the medical professionals are saying and stop following false narratives. My cousin friend told me that their legs swole up. We've got to stop with this. We will never come out of COVID if we are not vaccinated, period. We've got to be vaccinated.
Okay, Chair recognizes for the first round who have not stated, Councilman Braddock, followed Councilman Braddock, we have Councilman McCall. And following Councilman McCall, we have Councilwoman Pat Gibson Highmore.
Thank you, Madam Mayor. Now, I'm of the firm belief of do as I do, not as I say. And as the executive director of the House of Hope and having more than 50 employees, I didn't want my staff to use my views as a reason not to get vaccinated. So even having had COVID, I had COVID in August of last year. When it was made available to me, I chose to get vaccinated because I didn't want anyone on my staff using me as an excuse not to make their decision. You know, so that's what I did. That's what I support. I don't want to do anything that's going to discourage someone from taking a step to protect themselves. And so, you know, I believe in liberties and freedoms. I'm very conservative, but I do believe that recommending our community to get vaccinated is something that I recommended for myself. I recommended for my staff. And so I can definitely go along for some same reasons, for different reasons, supporting this resolution.
Yeah, thank you. And again, it frustrates me too. To me, I'm from law school. We don't reinvent the wheel. And what I'm seeing with this, we've been down this rodeo before. We've defeated pandemics before by getting vaccinations and following what the doctors actually say get done. And so it kind of baffles me that we're listening to the misinformation that's out there on Facebook or talk radio and things of that nature. But again, I'm proud to be amongst my brethren here today and strongly encouraging. If brethren is females, it's both. But I'm proud to be amongst my brethren today and encouraging our citizens to definitely get vaccinated. And I think it goes hand in hand with the city is now gearing up to do a vaccination campaign. Me, George, and Braddock is a part of the marketing committee working with Amanda and Hannah. I think we have two superstars heading that program. And I think it's going to go hand in hand in what we're trying to encourage here today, and that's getting more people vaccinated, helping us get to that 70% where we can safely try to combat the spread of this COVID-19. So again, I'm glad we're getting this passed, and hopefully, and I'm pretty confident that our vaccination campaign will let the community know that we're taking this very seriously, and vaccinations is what's needed to get us back to as normal as we can get. And hopefully they see heed to that, and we can move the city forward. Thank you.
Councilwoman Moore.
Okay, misinformation and politics is literally killing people. I was out of town last week. I returned the day of our city council meeting, early that morning. We tried to reach my niece on my husband's side from where we were in Massachusetts. The first time we called, we spoke with her. After that, we no longer could reach her. We found Monday after the city council meeting that she was in her bed dead for 4 days because she refused to take the vaccine because of misinformation and politics. We can't let that happen. We can't let this political climate, as Latoya Barnes, Councilwoman Barnes stated, take over our lives. There's so many things that we need to do to protect not just ourselves, but others. So it's like she said, we've been getting vaccines since the day of our birth. So what's the problem now? We have to get away from this political climate and this misinformation. We're damned if we do and damned if we don't. So I'd rather be damned if I do and get vaccinated than just not do it and in my bed dead for 4 days with no one knowing what happened to me. And she died from COVID. And it's unfortunate that her son was in the house with her that entire time, but didn't realize that she was dead because he has some mental disabilities. He's a grown man, but he thought she was asleep. All because of misinformation, not wanting to be vaccinated and not thinking the mask was important.
Chair recognizes Councilman Trailer.
So with regard to other vaccine efforts that have been done through history, and I think there have been several people mentioned, there was a letter to the editor that was in the morning news on Sunday from a local doctor. And I'll just quote from some of it because I think it's very relevant to what we've been talking about here and our timeline of what we've been dealing with over the history of this country. In 1777, a smallpox epidemic threatened the war effort, so General George Washington ordered the smallpox vaccine. In 1901, during a smallpox epidemic, a pastor would not comply with the public health measures based on freedom. The U.S. Supreme Court in Jacobson versus Massachusetts upheld the Board of Health's authority. In 1922, parents of a Texas student refused to comply. In Zuck versus King, the U.S. Supreme Court said that these rules confer the broad discretion required for the protection of the public health. So do public health measures work? Smallpox killed millions of people over the centuries, and the infestation rate now is near zero. Measles killed an average of almost 600,000 people per year in the 20th century, but only killed 81 in the year 2000. There are also similar successes with mumps, with polio, and with more. The COVID vaccine is a result of decades of research. It does not give COVID, it does not change your RNA or place tracers in your blood, but it is safe and effective. And so this is the medical statements in the medical community. And here are doctors coming out with letters to the editor, again, saying to our community, as we're saying here now, please, this is nothing new. It's just something that is absolutely critical. It's absolutely needed. And now is the time. And I am so proud of us for having the opportunity to vote on this resolution and to make this become a reality. Thank you.
Is there any other discussion? Well, for me to summarize, I say unto you, Mayor Myers Irving, then I will answer as I would answer at the medical facility I work. Teresa Irving, RN, location. Since last year, 2020, I have worn a mask when we initially identified this virus and this disease. Since last year, I've told people that if you can breathe and you have lungs, you're a candidate for this disease. The answer, solution for us to come out of this is mask and vaccinations. I understand the political realm when we speak about our rights, but when it comes to our rights is only our rights when it does not spread over to someone else's right. We all breathe the same air. I have taken my third vaccine this past Friday. So I'm the team with the 3 vaccines. When it comes to doing what it takes to prevent this spread, I tell people I wear a mask to protect you. If I am a COVID-19 carrier, I may walk around and maybe feel like I only have a stuffed nose. If you've not been vaccinated and I am vaccinated and not wearing a mask, I'm feeling fine. I get around you, I talk for around a little while. When I walk off from you, my being a carrier, I could have just infected you. I go on to live another day to walk around without a mask to spread my COVID-19. you may die. And if you don't die, you may hopefully be able to get one of the intensive care beds if you're on a ventilator, if there's a ventilator available. We are at a place that we should have been coming out of COVID-19, but our rights has kept us in a position of allowing COVID-19 to kill us, to kill our family members and friends. I thank each council member for their thoughts, but the ones who will bring us out of this particular pandemic will be our family members and friends. Family members and friends can talk to the ones they love, and they can influence them more than we can with any vote we place before you. Yes, this resolution will encourage you to do this and encourage you to do that, but encouragement is not going to save lives. Our willingness to wear our masks to protect each other, our willingness to get our vaccine to build immunity is what will bring us out of this. You need both, your mask and your vaccine. Because if I get my vaccine and I'm a carrier, I still can kill you if you're unmasked and in protection. And I'm going to leave that with you right there. This is enough. Solution seems to be simple. It's a medical solution to a medical problem. This is not a political pandemic. This is a public health care crisis. I've stated this since last year, and I hope this time next year, I'm not stating this again. We're in a medical crisis. And the answer is medical solutions. Whether you like it or not, we're getting directions from our CDC and from the FDA, locally from our South Carolina Health Department. Simple as that. They are the leaders. They are the experts. That is where our direction must come from to help lead this city through this crisis. Not only do we have to recognize our city, but also our county, because we have people coming in and out of the city of Florence every day. COVID-19 does not stop just because you come to the circle and you're saying you're crossing over to the city of Florence, you bring it with you. When you cross over out of Florence, South Carolina, go to another area, you take it with you. And I want you just to think on that. This virus don't care anything about who we are, what party affiliations we have. It wants to live. And if we have to die for it to live, it will gladly help us to do that. Now I ask you, what part are you willing to play to stop this virus? Now we'll just leave it at that. I'll just have to leave it there. Thank you. At this time, is there no other discussion? Are you ready for the question?
Yes.
All those in favor, please signify by saying aye.
Aye.
All those opposed, like sign. Thank you to this council. Let the record show that this resolution number 2021-15 has passed. At this time, we're getting ready for introduction of ordinance. The first ordinance is bill number 2021-32. This ordinance has two options for an emergency ordinance to replace the existing ordinance 2021-08 and resolution number 2021-15, and to extend emergency measures put in place previously by emergency ordinance number 2020-28, which consolidated emergency ordinance numbers 2020-12, 2020-13, and 2020-20 in response to COVID-19 emergency.
Madam
This-
Mayor, at this time, I'd ask for executive session so we could take information from our attorney.
So we have a motion and a second. At this time, there's no objection. We will enter into our executive session. Just returned from executive session where no vote or no action was taken. And as we're returning to session now, we are back with our disposition of introduction of ordinance in which
Madam, I make a motion that we adopt option 2, which is a option to strongly encourage our citizens to wear masks, and specifically includes schools and daycares as a part of the face covering resolution that is a strong encouragement for our community.
Do we have we have a motion in a second? At this time, we have discussion. Do we Chair recognizes Councilwoman Moore.
Madam Mayor, I like option one.
Do you want to make
I
an
make a-
amendment?
I'm sorry.
Do you want to make an amendment?
I make an amendment that we adopt option one because option two is so political. I really don't care what the South Carolina Supreme Court thinks.
We
I
have,
don't
we
care.
haven't, we have a motion
Okay.
to amend. Do we have a second? I will second. We have a amendment now on the floor
Discussion.
and which is now open for,
Okay, option one, because people aren't being serious enough with staying distant and getting vaccinated. It's become so political. The South Carolina Supreme Court, our Governor McMaster, our Attorney General, it's like Democrats against Republicans, not about keeping people safe. We should be worried about people. People walk around and they're crowded together with no mask, without getting vaccinated. We're having more deaths now. We need to worry about our people, not about political affiliations, and that's what's happening. You would go in someplace and see one person with a mask and 50 around that person without a mask. I think we need to do a mandate. If I'm mandated to wear a seatbelt, if I'm mandated to put a child in a car seat in a car, why can't there be a mandate? That helps save lives. Why can't we wear a mask for a while longer to save lives? Well, then if we can't mandate masks, I shouldn't have to wear a seatbelt. I shouldn't have to put a child in a car seat in a car. What's the difference? We're trying to save lives. The whole mask mandate is to save lives. If we do what we should do with the vaccine and the mask just a little while longer, we may come out of this thing okay. But as long as we want to separate, make it political, we're going to stay right where we are and people are going to continue to die. So I am for option one and for enforcing it, for actually enforcing the mask mandate. That is the only way that this pandemic is going away. We have to do what it takes to make it go away. It's up to the people. It shouldn't be up to the political arena. We have to keep ourselves safe. People working in hospitals, emergency rooms are packed with people with COVID. The hospitals are packed with COVID victims. We need to do what it takes to help keep people alive, to keep you alive, to keep you alive, to keep you alive, and to keep me alive. I really don't care what the governor is saying, or the Supreme Court, the South Carolina Supreme Court, or the Attorney General. They're only thinking about getting votes next year. That's what McMaster is thinking about, becoming governor next year, and Alan Wilson. So I am definitely for option one, and hopefully it won't be that long, but it's necessary right now.
you have it. Chair recognizes Councilwoman
Um,
Florence.
Pat, Councilwoman Moore, yeah. With what she said, I can't say we all agree that masks are very, very important. We do. My concern is I have a family member that refuses to get the vaccine because she wears the mask. And we are not saying that the mask is end all and be all. If we just do the mask, we will be in this forever. What I am concerned with is I had a church member to die 2 weeks ago. It was not him being out in the streets. COVID came into his home. When we are around familiar people, we don't wear masks. When we're with our family and friends that come home, our kids come home from school, we're not wearing masks. and we are spreading this disease. And so I toil on these both of these options because some are using this mask as end all be all, and it's not. You cannot. So I don't know if we want to discuss that or however. That's my concern. COVID is being spread in the homes, in the communities, in close knit areas. It's not in Walmart. It's not in the grocery stores. It's when we are coming home and relaxing and taking off the mask. And so I'm concerned with, we can't mandate in homes. We can't, but we still are faced with ending this disease. So that's a concern.
Any other discussion? Chair recognizes Councilman Braddock.
So, in terms of it being political, everybody knows I'm a Republican, I'm a conservative. And I have had COVID and I have had the vaccine and I am wearing a mask. I believe, in personal liberties and freedoms, and I want to incentivize. I'm all for recommending vaccinations because vaccinations are the solution. That's going to protect people. I feel like, again, as Councilman Barnes is saying, is that people are hiding behind the mask. They're using a mask as a reason to not get vaccinated. And when we look at the vaccination rates, they're being suppressed in certain areas where people are choosing to get a mask instead of vaccinated. The other issue is that we see, and Councilman Jabali brought this to my attention, I wasn't aware of it, but we see the rates of infection ebb and flow with people coming together, holidays, situations like that. And we're going to be going into the holiday season. And just to show you, Councilwoman Barnes, Councilwoman Moore, that I'm not political, if we do a resolution encouraging vaccination, if we put in an ordinance strongly recommending masks, and come our November meeting, we're not seeing an increase in vaccination rates. We're not seeing a decrease in infestation rates. Then I would be willing to support a 60-day mask ordinance through the holiday period when we're coming together. People are shopping, people are going to restaurants, people are getting together with family. If we don't see a change with these two resolutions and this ordinance, then I would be supportive. But I want to give the people of Florence, you said it's up to the people. I want to give the people the option. Go get vaccinated. Wear your mask, when you can, socially distance. We're giving you the opportunity to combat this and to, my plea is to do it so you don't put us in a position. I don't want to be in a position where I've got to try to protect a server at a restaurant or someone working at a retail place over Christmas, because our infectious rates are high and our vaccination rates aren't moving. So it's not political for me. I've done what I've done because I believe what the Bible says, do unto others as you would have them do unto you. And if I'm taking the steps to get vaccinated, if I'm taking the steps to wear a mask when I'm asked, then I feel like I'm doing that freely. And I feel like people have given the option and they don't need us to tell them what to do, that they will do the right thing. I trust the community. I trust the citizens of Florence to do the right thing without me having to tell them what to do.
Is it, recognize Councilman call for a first round. After Councilman call, if there's no other council members, Chair will recognize Councilwoman Moore.
Again, if this issue is a tough issue because it's moving political, and I get it, but I think at some point we have to give the people an opportunity to respond. Again, I don't want to be in a position myself where I'm mandating someone to do something as well. However, I think it goes hand in hand of what we're trying to accomplish with our vaccination campaign. And that's moving our vaccination rate to closer to 70%. And so if we're saying that if it's not up to 70% by November, that we will then be inclined to mandate. So I guess we're giving the people the opportunity. I do not want to be up here voting and telling nobody what to do. That is not why I think I was elected here. And I don't want to be in that position. But at the same time, too, I do understand that, again, the holiday season is coming along, and those are when the prime time is when numbers will spike. And I think we can get to 70%. I don't think we'll have to actually have the masks. I think we can probably go without them. However, again, I just want to give the citizens of Florence the opportunity to do the right thing. This is not a give me liberty or give me death moment. This is a let's do the right thing moment. Let's protect one another. Let's move the city forward. And I think we all can agree that the way out is not masks, it's vaccinations. So again, I'm supportive of giving the people the opportunity at this moment to try to get us to 70% vaccination rates, and hopefully the city can help us get to that goal.
Chair recognizes Councilwoman Moore for second response, then Councilman DeVito for second response. Oh, well, since you did a motion for the first, no, you made a statement.
Okay.
Councilwoman Barnes.
As I said before, and as the mayor said before, we need to get vaccinated, but we also need to wear the mask to keep our others safe as well as ourselves. Sometimes you have to tell people what to do because they're not going to do the right thing on their own. So if I get in my car when I leave here and not put on my seatbelt, and I get stopped, can I say, well, you can't tell me what to do? I don't have to do it because it's my choice. Or if I put a child in my car without a car seat, okay, you can't tell me what to do. That's my choice. It's the same thing with this mask. Sometimes you have to tell people what to do so they'll do the right thing. Not just wear the mask, do both, get vaccinated and wear the mask, and let's get this thing under control. We always talking about we don't want to be told what to do. You've been told what to do all your lives. So what difference does it make now? All we're trying to do is save each other from getting sick or from dying. If you go to the hospital right now, there's so many COVID patients there that could probably not be there if they just did the right thing. Maybe get vaccinated and wear a mask when out in public. I still go get tested periodically because even being here in this atmosphere, I'll go get tested because I want to know. It's up to us to try and save each other. You want people to tell you what to do. Well, nobody wants to really be told what to do, but sometimes you have to be told what to do. So you'll do the right thing. And it's gotten really too political. Too many people are dying. We have the numbers here of deaths in Florence County. It doesn't look like, but it's not a small amount of number. It's a lot. One person is a lot. All we have to do is try and keep ourselves and others safe. Getting the vaccine and wearing the mask just a little while longer. And if I have to tell somebody to wear that mask, so what? I don't even let people come in my house now. I meet them on my porch, mask up. Because it's up to me to help. If people don't like it, they don't have to come talk to me at all. I don't care. But we have to do what we can to be safe. Get vaccinated and wear the mask. And if somebody have to tell you to do it, so be it. They had to tell us to wear car seats. They had to tell us a lot of things, and we did it. So what's the difference? The mayor explained how it is in the hospital. She works, she's an RN. She sees a lot that we don't see. She sees more death than we see. We see death from in our own families. So what's wrong with being told sometimes what to do if that's what's best for you? I don't mind being told what to do if it's gonna help me, or if it's gonna help someone that I love. And I love all of you, so I don't mind being told what to do, or you telling me what to do by wearing this mask. I don't want to see each and every one in this room tomorrow and the next day and the next day. I don't want to hear of your funeral because you got COVID, because you didn't want to wear a mask, because you didn't want anybody telling you what to do. No, sometimes you have to tell people what to do because they're not going to do it on their own. So yes, I'm for option one, for mask mandates and enforcing it.
Councilman Jabala.
Thank you. I think it's really important that everybody understand this entire city council is absolutely committed to the importance of wearing face masks. I don't think anybody is saying this is something that's not important to be done. In fact, regardless of which one of these ordinances passes, both of them are a statement of the importance of wearing face masks and helping to fight what is going on in our community right now. So both are the same in that regard. If you look under section 6A, there's some differences between option 1 versus option 2. And if you look at section 6A, it says, where does this apply? So we know all automatically that the city of Florence and all the city buildings has already implemented mandatory face masks, like any business. And I'll also say there's many, many other businesses out there that are currently doing that. Jabala Law Firm is one of those. You go to my law office and you see a sign on the front, we are requiring people who come in to have a mask on. This is, and we provide you a mask if you come into the law firm. So lots of businesses are voluntarily doing it. This ordinance, these ordinances apply to establishments open to the public or food service establishments. That's what it applies to. That's what we're speaking of, whether it's strongly encouraging or whether it's mandating. It's speaking not to someone's home. It's speaking not to what's going on outside. It's speaking to what are certain businesses open to the public or food service establishments. That's the limitation on what these are speaking to. And in both instances, they're saying, wear your mask. Wear your mask when you go out, socially distance. We are absolutely speaking in unanimity on the importance of wearing a mask for everybody. That is without dispute. One important distinction between these two is the one that mandates the mask says in section 6A, since schools and daycares have limited public access, they are not included as an establishment open to the public. So the mandate specifically excludes schools and daycares. But if you look at option 2, which is the primary motion initially made, it says schools and daycares are specifically included in the establishment open to the public for purposes of this ordinance. So under the option 2 that is before us, schools and daycares are included to encourage, strongly encourage, the use of wearing masks. And how is that important? Today's morning news has it right on the front page. Yes, Matthew, I see you out there. Giving a little props out there. Victims getting younger in South Carolina. Victims getting younger in South Carolina. We have been instructed, told that we have no authority to tell the schools what they can and can't do. But this ordinance that is before us, option number 2, has in it a statement of policy on the part of this council that schools and daycares are specifically included in the establishment open to the public for purposes of this ordinance to encourage strongly encourage the use of masks. I would submit that the epidemic has hit the schools, the epidemic has hit the homes, and that's where the transmission rates have been taking place. Again, as we all unanimously voted on before, vaccinations are the answer. Please continue to wear your mask, but don't use the masks as a tool to hide behind to not get vaccinated. That is not the way out. There's no science that says that is the way for us to survive and thrive going forward. The science is clear. Vaccinations are the way. In the meantime, while we are building up the numbers of newly vaccinated people, increasing those numbers, and hopefully our plan to get the word out goes forward. In the meantime, wear your masks, wear your masks, wear your masks. And option number 2 specifically includes the schools. We know what's happening in the schools. It is a statement of public policy on our part. I strongly advocate that we adopt option 2, which specifically includes the schools. And at this time, I call the question.
Recognizing the fact that I, as mayor, have not given a statement before a question, I request time to make a statement, no objection. Recognizing, acknowledging everything stated by the council, I respect your thoughts. Option 1, city mandate. Option 2, continue to do what we do now. That is the sum of what we're saying. Medically speaking, the school board has spoken for the school board, stating they want masks. This is not new. I communicated with the school superintendent prior to the school board passing their mandate. We did not take up, and I did not ask the council to take it up because all the schools are not in the city. So that was not something that would be an answer for the school board, which has a governing body, who stepped forth to pass a mask mandate in the face of what they knew would happen from our state legislation. Now, we are talking about what news article said. I asked every one of you, go to the CDC, go to South Carolina Department of Health and Environmental Control and see where they've told any of us, well, masks or vaccination are the answer. I'm sorry, medically speaking, masks and vaccinations are what the medical communities are calling for. You go to these medical institutions, regardless to what, I have 3 vaccines. You will not see me walk in that area without a mask. Masks and vaccines are the actions. What is being posed before this council today, we will not step out there and drive a car without a license. That's a mandate. As a governing body, we have been chosen and elected to do what is correct in guidelines for the best of this city. Regardless to how long the speeches have been, the end results, mask and vaccination is the answers. When it comes down to advocating for vaccines, I've done that. I've done things even with the South Carolina Department of Health. What we're talking about with this advertisement, that's not new. We're doing that. That's being done on a national level. That's a Band-Aid. We need masks and we need vaccination. The question we call is simple as that. Either you're voting to continue to do what's going to bring us out of this pandemic, not epidemic. Those are 2 different titles. We are in a pandemic. And I, for one, will speak for myself as political and for medical. Short of having a mask mandate and pushing for vaccine, because vaccines right now is not mandatorily, military mandated. We're simply making a choice. We're going to put a mark down for the history of the city today in these choices and these votes. And if I vote, and I am going to vote, that we need it, I will vote by myself because I want history to reflect that I understand politically and medically where we're at. I don't care your affiliation. I could care less what your titles are, but your life is what's important to me. That's my bottom line when I make any vote. You can pull up newspapers, you can pull up these. We need masks and we need vaccination. For any of those who will hover against, welcome, please do so. I'm trained to treat everybody like they've got something. If you're in the medical profession, that's one of the first ground rules you were taught. Treat everybody like they got something, because you will not know who always have COVID-19. I don't want to hear the things of the excuses we give. COVID-19 is transferred not only in the home, we've not had it in our home. Even before vaccine, we masked up. I go into those environments. I've got a son who's a doctor, who's worked in COVID units and still work there. Daughter in ER, future daughter-in-law in the COVID unit, son on the front line. My husband worked front line each time. For me, this is personal. I don't take little short splits and boo, 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 and wait. There's so many people going to die between now and the next time we meet together. I promise you, when you look at the days end of the deaths that we're going to have, if you choose not to wear a mask, that's your choice. But if you choose not to get a vaccination and you don't get it, that's your choice. But when you get COVID, you don't have any kind of protection to hopefully decrease the risk of this disease. Understand, vaccines will not prevent this disease necessarily. I often joke, and I told some of these already. COVID-19 vaccine is just like birth control. It's not 100%. If you get COVID, the goal of COVID-19 vaccine is simply to keep you from being so sick that you have to be admitted to a unit and placed on a ventilator. Understand and hear me clearly. This vaccine does not mean that you're not going to get the disease. And I'll say it again, and I'll stand for anyone. It will not promise you will not get the disease. The purpose of this vaccine is to decrease the effect of that virus on your body. How simple as that. That's what your vaccine is for. Your masks are to protect your airway, so the COVID virus will enter your body. The two together is the most effective way. It's not an either or when it comes to medical leave. So I'm speaking as a medical profession, and I'm telling you what I know from being in this realm. It's not either or. So today when we vote, either we're going to vote to have a mask mandate, or we can vote to do what we're doing right now, hoping and encouraging and praying maybe someone to wear a mask. That's our choice. As simple as that. There's no way to make it any prettier. I'm hard. I like things simple. Option one, which is presently what we have of a question, whether or not we're going to amend and vote on this. And if we amend it and accept it and vote on it, and if we don't pass it, it doesn't matter. That's simply saying we're still going to do what we're just doing now. Having our mask mandate in our city business and hope everyone else would do it. So it's no big deal, y'all. We can amend, and I would encourage this council to amend, and let's vote on up or down. Make it plain, make it straightforward and simple. Don't politicize it. Either we can do a mask mandate or we're not. I call for the question. All those in favor of the amendment, please signify by
Which one are we voting on?
amendment, whether or not to take option number one to vote upon it. We will vote it up or down if we do the amendment.
Option one.
Okay, option one. So all those in favor of the amendment for taking option one to vote it up or down, please signify by a show of hands so I can have a complete number. All those in favor of the amendment, please raise your hands. So let the record show that Councilwoman Pat Gibson High Moore, Mayor Teresa Myers Irvin voted for the amendment to have option one, a citywide mandate in place. All those in opposed, like sign, raise your hand. Let the record reflect that we have 5 members of council. Schofield, McCall, Bailey, Barnes, and Braddock voted down the amendment for citywide mandate. So the amendment has failed. Now we have, as originally motioned, the original motion to do option two, which is no citywide mask requirement. All those,
Some discussion on that.
sure.
Thank you. So the option number two that is now before council, again, it's very, very important that our public understand that this is going to be a unified voice of council that says, please use your masks in conjunction with the earlier resolution on the vaccinations. Please get vaccinated. as the mayor said, it takes both mask wearing and vaccinations. And what we are doing today, if this ordinance passes, is to make a statement saying, we strongly encourage that it's used in all public buildings, that it's used in any business establishment, and it's used in the schools. And please be careful when you're at home. This ordinance does not, and no matter which version of it is, it doesn't affect what people do in their homes. We know that's where high levels of transmissions occur. Please use the social distancing guidelines that CDC says. Please use the masking requirements and recommendations that CDC says. It's already in place in the public buildings in the city-owned building. You're going to be required to wear the masks. Please get vaccinated. Please wear the masks. That is what we're recommending here with option number 2. Thank you very much.
Chair recognizes Councilwoman Barnes.
And maybe I just lost where we are, but what Councilman Braddock said about trying something for 60 days, and if it's not back, us saying before we go into the holidays, we come back and we can possibly agree that we are going to have to mandate. I don't want to leave because Councilman McCall said, you know, we want to give you, the people, the citizens of Florence, the opportunity to not force us to do a mandate by getting this. So what is helping me with this second one, if we do what Braddock is saying, is it incentivizes people to go out and be vaccinated. If that is not the case, then we are forced to actually do the mandate. I don't want us to not look at that, because it's either you help us or we have to do things that you don't want us to do by what Councilwoman Moore says we're gonna have to make do a mandate. So is it possible that that could be a part of or is it too late?
Well, I think
It
excuse me,
already,
Zach.
it will come back up in 60 days anyway.
Okay.
We will have the time
Yeah.
to do that. So that is
Guys,
Chair recognizes McCall.
Yeah, I wanna-
Councilman McCall.
I want to reiterate on this, and I want to make it readily clear on my position on it. If we're not at 70% vaccination rate by the November meeting, I will be voting yes to mandate mask. But I believe in the citizens of Florence, and this is their option. If you don't want to get it to 70%, we'll be voting for a mandate. If you want to get it to 70%, we probably will not be voting for a mandate. But I'm telling you now, if we're not at 70% for the November meeting, I will be voting yes for a mask mandate. And that's my end of my discussion on that.
Chair recognizes Councilwoman Moore.
So could someone tell me, are we now amending option 2?
What we're, no, we're not amending. No. No. There, right now where we're at, they vote for it. You know, it still will come back up. It's not, we can look at it again in without the either 6 days from now, we can review that next council meeting. 60 now, so
About 45 days.
well, closer, we're, so this is actually a special meeting. We have October meeting. November meeting really will not be 60 days. And if you're going to evaluate, that's not enough time for you to evaluate. You would realistically be looking at someplace around the line about December.
November is when I'm voting in November. If it's not 70%.
Well, you can put it
November.
on, you can request put on the agenda, that'd be no issue.
Yeah.
And is there any other discussion on that? Just in closing, in my summary, to reiterate, vaccinations been available since January of this year, February. So there's an adequate time for those who wants to get vaccinated to have done so. Mask ordinance were initiated actually back in 2020 by our prior mayor and our council. We actually did this prior to even for the governor doing his. We were in the forefront leading mask mandates. We came out from under mask mandates back in April. So from April to this time period now, you've had the option to choose between wearing a mask and getting vaccinated. The numbers have been sluggish, have not been on the rise. We as a city have done things working with DHEC, MUSC, McLeod to actually encourage people to come out and get vaccinated. We've done the pop-up vaccination, which was encouraged by one of our council members. There's Will Bailey with the science, and myself have worked with DHEC. So all these wonderful things we're discussing now, we've been doing, and the numbers have not been climbing. So when we come to the vote, I will stand firm for medical, that we do need masks and we do mask mandates. And it's for this reason that even I do believe in encouragement, I will vote against this because encouragement is not enough. We've got our facts. We've seen what this disease has done and what is doing, and we've seen the projected rate of how the vaccines have not been readily received by everyone here. So at this time, are y'all ready for the question? Okay. All those in favor of the option number 2 of just encouraging, please signify by saying aye. All those opposed, nay. Nay. Let the record reflect that for a 5-2 vote, that option number 2 to continue as we are without any mask requirement has passed. If that concludes all the information here, let me be here. All right, and we've already got a legal advice there. We have a motion to adjourn.
So moved.
The motion is second to adjourn. All those in favor signify by saying aye.
Aye.
Aye.